Part 7, wrapping up ovarian cancer survival. And I'm not going to get into a ton more here. I left another link in my slideshow showing all the different subtypes and the 5-year survival rates with local, regional, and distant disease. The upshot with all of this is that the survival rate stinks with ovarian cancer because we don't have a screening method at this point that's reliable that we can use to detect women early and not have a ton of false positives. Because of the type of cancer it is, the symptoms don't lend to being detected at an early stage like prostate cancer. And the most common subtype is going to be this invasive epithelial cancer, which is more aggressive by nature. And so you're finding it later. It's not going to be easy to treat. And so it's just a very, very difficult recipe to deal with at that point. So dealing then with the male equivalent, testicular cancer. So this one doesn't show up on either top 10 list, either for incidence or mortality, and that's a good thing. And we'll get into the reasons why. Hint, hint, this isn't because we're particularly good at screening for anything. So risk factors, cryptorchidism. And I wanted to mention this one for a second. Cryptorchidism means undescended testicle. So when babies are born, male babies, their testicles actually develop by their kidneys and descend when the baby is in utero and inside mom. And a lot of times they're not descended even by the time they're born. They're supposed to descend at birth or shortly thereafter. The longer it takes for them to descend, they're at a higher temperature, and that's actually a risk factor for a male developing testicular cancer when they get older. In fact, if it's not detected much past 6 months to a year of age, the risk of testicular cancer goes way, way up. Toddler boys will have surgery actually to bring the testicle down and literally pin it down in their scrotum in order to A, preserve fertility, and B, decrease their risk of testicular cancer. Moving on, family history, of course, that's always in our slides. Age, it's very common between the ages, or I shouldn't say very common, but most common between ages of 20 and 35. It's more common in taller men. It's 4 to 5 times more likely in white men. And other risk factors are HIV infection and then cancer in the other testicle. A lot of times the tumor is one-sided. Signs, symptoms, very few. So usually painless swelling in one testicle or fluid buildup in one testicle, and that'll show up as swelling in the scrotum. Swollen lymph nodes then in your pelvic area or your groin. And then if you start getting tumor mets, you might start having pain in the abdomen or the back. So maybe if you've had metastases to like your bone at that point. Incidence, prevalence, mortality, a little bit under 10,000 new cases per year. Out of that same 159 million men that I've referenced with prostate cancer, about 1 in 250 men will have this diagnosis in their lifetime. So that gives you an idea of prevalence. And there's 440 deaths per year out of that same 159 million men. So you can see why it's not on either list. Lower incidence, lower prevalence, and much lower mortality rate. 5-year survivals at 95%. And I point your attention to the survival for distant disease. That's 73% for distant disease. So even when you've got mets beyond, the regional area and you're getting radiation and chemo, that tumor is still responding to chemotherapy and radiation therapy, which is not common for most things. So not that you want any cancer, but if you're going to get cancer, take your shot with testicular cancer. So we're doing well, right? Well, we'll get into screening and not necessarily.